Determining how to help a person who becomes suddenly ill can be difficult. Some illnesses can strike with no warning, including fainting, seizure, stroke, diabetic emergency, allergic reactions, poisoning, and fever. Common signals of sudden illnesses include dizziness or unconsciousness, trouble breathing, signals of a heart attack such as chest pain, discomfort, or pressure that may spread to the shoulders, arm, neck, jaw, stomach, or back. Signals of a stroke, such as sudden weakness on one side of the body and sudden trouble with speaking or getting words out, loss of vision or blurred vision. Signals of shock, such as rapid breathing and ashen skin. Sweating, persistent abdominal pain or pressure, nausea or vomiting, diarrhea, or seizures. Certain sudden illnesses require specific care. In general, to help a person experiencing a sudden illness, do no further harm. Monitor breathing and consciousness. Help the person rest comfortably. Keep the person from getting chilled or overheated. Reassure the person, and give any specific care needed. Call 911 or the local emergency number for the following conditions: unconsciousness or altered levels of consciousness, trouble breathing or no breathing, signals of a heart attack, persistent abdominal pain or pressure, severe external bleeding, vomiting blood or passing blood, severe or critical burns, suspected poisoning, seizures, stroke, suspected or obvious injuries to the head, neck, or spine, or painful, swollen, deformed areas, or an open fracture. A seizure is the result of abnormal electrical activity in the brain that causes temporary, involuntary changes in body movement, function, sensation, and awareness or behavior. Most seizures last only a few minutes and can include the following signals: a blank stare, a period of distorted sensation during which the person is unable to respond, uncontrollable muscular contractions called convulsions. Call 911 or the local emergency number if the seizure lasts more than 5 minutes. The person has multiple seizures with no signs of slowing down. The person appears to be injured or fails to regain consciousness after the seizure. The cause of the seizure is unknown. The person is pregnant. The person has diabetes. The person is a young child or an infant who experienced a febrile seizure. The seizure takes place in the water. The person is elderly and could have suffered a stroke. Or the person has no known history of epilepsy or seizures. If a person is actively seizing, remove nearby objects that could cause injury, protect the person's airway, and allow the seizure to run its course. Attempting to stop a seizure or restrain the person can cause injuries. Do not place objects or fingers into the mouth of an actively seizing person. Recovering from a seizure usually takes just a few minutes. The person may be disoriented and drowsy. Reassure the person as you monitor his condition.
What's your name?
A fever occurs when a person's body temperature is higher than 100.4 degrees Fahrenheit. Fevers are common in children and infants. Signals of fever include skin that is hot to the touch, chills and body aches, headache, trouble sleeping or oversleeping, drowsiness, and lack of appetite. Additional signals for infants include being fussy and crying, becoming listless, and rapid breathing. Young children and infants with a fever over 103 degrees Fahrenheit can experience a heat-induced seizure called a febrile seizure, lasting less than 5 minutes. Febrile seizures are not usually life-threatening and produce different signals, which include a sudden rise in body temperature, change in the level of consciousness, rhythmic jerking of the head and limbs, confusion, drowsiness, crying out, becoming rigid, holding his or her breath, an upward rolling of the eyes. Call 911 or the local emergency number if the child or infant with a fever has signals of a life-threatening condition, such as unconsciousness or trouble breathing. For a child who has experienced a febrile seizure, call 911 if it's the child's first seizure, or if the seizure lasts longer than 5 minutes, is repeated, or is followed by a quick rise in temperature. Infants younger than 3 months with any fever, and children less than 2 years with a high fever greater than 103 degrees Fahrenheit, require immediate evaluation by a healthcare provider. If the child or infant has a fever, make him as comfortable as possible. Encourage rest and make sure he drinks plenty of clear fluids. If the child has a high fever, gently cool him. Never rush cooling down a child. If the child experienced a febrile seizure, rapid cooling could bring on other complications. Remove excess clothing or blankets and give him a sponge bath in lukewarm water. Comfort him as you monitor for changes in his condition. Before giving a child any medication such as acetaminophen, contact a healthcare provider. Do not give aspirin to infants or children under 18 years old. Aspirin has been linked to Reye's syndrome, a serious medical condition that affects the brain and other internal organs. A stroke or brain attack occurs when blood flow is blocked from reaching part of the brain. A stroke can cause permanent damage to the brain if not treated soon after the onset of signals. A person experiencing a stroke needs immediate medical attention. When a person is suffering a stroke, she can experience weakness or numbness of the face, arms, or legs, severe unexplained headache, facial droop or drooling, difficulty speaking or comprehending, vision loss or disturbance in one or both eyes, dizziness, confusion, agitation, loss of consciousness or other severely altered mental status, loss of balance or coordination, trouble walking, or incontinence. For a stroke, think fast. Face, arm, speech, time. F stands for face. Ask the person to smile, then check to see if one side of her face droops. A is for arm. Ask the person to raise both arms to check for weakness or numbness in one arm. Watch for one arm to drift down. S means speech. Ask the person to repeat a simple sentence. Is the person slurring the words or able to repeat the sentence correctly? T stands for time. Make note of the time the signals first appeared. If the person shows any signs of a stroke, call 911 or the local emergency number right away. Care for any conditions that you find until EMS personnel take over. Reassure the person and have her rest comfortably. Do not give her anything to eat or drink. Continue to monitor the person and note any changes in her condition. Relay all the information to EMS personnel when they take over.
Okay.
Mom, we're going over there.
Careful, you guys.
So what's cooking today?
Well, let's see. Same thing as yesterday.
Come on, I'll give you a ride.
So I was thinking we take those rocks and we push them a little closer to the street over there.
Yeah, that's a good idea.
Mom! Come quick! Jeremy's hurt!
Get the first aid kit and get some ice too.
Jeremy, you're bleeding and I don't have anything.
Okay. Oh, well, we're trained in first aid. I'm Eddie and this is Felix. Can we help?
Yes, please.
Okay.
Eddie's gonna help you, okay, honey?
Yeah.
Casey, are you okay?
Yeah, I think so.
Hey, mind if I take a look?
Felix is gonna help you, okay, honey?
Let me put this ice pack on.
All right, buddy. I'm just gonna put a little pressure on it just to stop the bleeding, okay?
Just hold on to my hand.
When a person's skin is broken and bleeding, she has an open wound. Most open wounds will stop bleeding on their own after a few minutes. In cases of severe bleeding, have someone call 911 or the local emergency number immediately. Check the scene for safety. Obtain consent to give care. Check the person. Follow standard precautions, including gloves and other personal protective equipment when providing care. Cover the wound with a sterile dressing or clean cloth. Apply pressure on the wound until the bleeding stops. Wrap a roller bandage around the dressing to secure it in place and keep pressure on the wound. Start from the end farthest from the heart. Overlap the roller bandage several times to completely cover the dressing. Tape or tie off the end of the bandage to keep it in place and keep pressure on the wound. If bleeding does not stop, do not remove the blood-soaked bandages and dressings. Apply additional dressings and bandages and continue to apply pressure. Do not attempt to wash or clean a severely bleeding wound. Your first priority is to control the bleeding. Take steps to minimize shock and call 911 or the local emergency number if you haven't already done so. In cases where an object is embedded or impaled in a person's skin, caring for the wound is slightly different. Do not remove the object. Removing it may cause more damage. Keep the object and the body part still. Place gauze dressings around the object. Lightly press the area around the wound, but do not press on or move the object. Surround the object with bulky dressings to keep it from moving. Carefully wrap a roller bandage over the dressings and around the object, but do not cover the object itself. Overlap the bandage until the dressings and object are completely secure, then tie or tape the bandage in place. Monitor the person's condition until a trained responder or EMS personnel take over. If bleeding continues, apply more bandages and maintain pressure. When people injure muscles, bones, and joints, there could be broken bones, strained muscles, or sprained or dislocated joints. An injury to muscles, bones, or joints may be severe if the person cannot use the body part, heard a snap, pop, or experienced grating bones or a loss of feeling in the area. You see bone fragments, swelling, and deformity, or notice that the incident itself caused severe injury. Call 911 or the local emergency number if a muscle, bone, or joint injury appears to be severe. The general care for a muscle, bone, or joint injury involves following RICE: rest, immobilize, cold, and elevate. Rest: do not move or straighten the injured area. Immobilize: stabilize the injured part in the position it was found. Minimize movement to prevent further injury. If you need to transport the person to get medical care, splint the injured body part unless applying the splint causes more pain. Cold: apply an ice pack to reduce swelling and pain. Place a thin barrier between the ice and the person's skin. Keep ice on the injured area for about 20 minutes if tolerated. Elevate: if there is no pain, gently elevate the person's injured body part, which may help reduce swelling. Do not elevate the injured part if it causes more pain.